and committee members for the opportunity to speak. I will try to keep it brief. My name is Jovanina Anthony. I practice OBGYN for the last 30 years, 18 years of this here in Jackson, Wyoming. I vigorously and absolutely oppose Senate File 109. I start by saying I've spent my life caring for pregnant women, and my job and passion is to serve the women of this state. I am not going to discuss the emotional aspects of abortion care. My objection is to making these medications illegal, much as many of the other physicians have testified. If Senate File 109 passes, this will truly be a crisis in the practice of obstetrics and gynecology, and this has nothing to do with elective abortion. Senate File 109 does make an exception for management of miscarriage, but the reality of banning and criminalizing these drugs is they will not be available, especially misoprostol. I use this medication literally every day. A partial list of uses of this medicine other than medical abortion include cervical ripening prior to induction of labor, management of postpartum hemorrhage, cervical dilation prior to hysteroscopic procedures in non-pregnant women, cervical dilation prior to IUD placement, induction of labor during the second trimester in the event of fetal death, and on and on. How will a pharmacist, whether hospital-based or outpatient, know that this prescription is not for medical abortion purposes? How will healthcare providers unfamiliar with abortion law know that they won't go to jail if they use it to ripen the cervix or use it for IUD placement? Really, who is going to take a chance on going to jail with a felony charge if we need to use this medication? A lot of emergent situations occur, as one of the other physicians testified, in the middle of the night. When are we going to argue with the hospital pharmacist? There are no lawyers, ethical boards, or legislators available in the middle of the night to discuss the legality of the usage of this medicine. This bill will further create confusion because misoprostol especially is a key component. Though of medical abortion, we use this all the time, as I've mentioned, for other purposes. And my concern is that we will have a lot of trouble obtaining misoprostol for legal usage when the prescription and use of the medicine is criminalized. I urge this committee to reject and oppose Senate File 109 on this basis. And I thank you, Chairman Baldwin, and committee members for the opportunity to testify today.
Thank you, Dr. Anthony. Questions for Dr. Anthony? Senator Bouchard.
Thank you, Mr. Chairman. The bill says in it, it's only for the purpose of performing an abortion. It doesn't outlaw any other use. Did you read the bill, and can you see that in the bill?
Yes, I did read the bill. So, for example, if I need to prescribe misoprostol to place an IUD, I will send a prescription in to a pharmacist to have this patient able to go and pick up that medication in a pharmacy. If the pharmacist is aware that it cannot be used for elective abortion, I suppose they can call and ask me what it's used for, but don't you think that that would really provide a chilling effect? If I tell that pharmacist, oh, we're not using that for elective abortion, I really have a hard time believing they'll just be like, oh, okay, here you go, here it is, when that is a potential felony charge with a prison sentence and a fine.
Thank you. Okay, thank you very much, Dr. Anthony.
Thank you so